Well, welcome. Good evening. Thank you for coming to tonight's lecture. I'm Peter Kern, Director of the Global Public Health Program, and this lecture series is sponsored by two organizations, the External Advisory Committee for the Global Public Health Program and the Institute for Health and Humanities. And we also are very grateful for Missoula Community Access Television for their willingness to film the lectures that we have in this lecture series, and then the link to those lectures go on our Global Public Health webpage so that you can revisit the lecture or tell your friends who weren't able to come tonight that they can get access to that through that vehicle. So let me introduce Leigh Taggart. Leigh has a BS in Nutrition from the University of Vermont, a BSN in Nursing from Westminster College of Salt Lake City, and in 2012 she received a Master's of Public Health from the University of Montana. She has worked as a critical care nurse for nearly 25 years. Since 2008, she has been working in rural Uganda on a public health project that focuses on post-war recovery and empowerment for families, and specifically women displaced by the war in northern Uganda. In 2012, she joined the Atlas Cultural Foundation, where she serves as the Public Health Program Coordinator. The Atlas Cultural Foundation's mission is, and I'm quoting, to collaborate with rural Moroccans to improve their quality of life in the fields of cultural preservation, community education, and public health. Along with her current nursing work in acute care, Ms. Taggart provides a service learning experience to Morocco for students of nursing and public health each year through Montana State University in Billings. She lives in British Columbia, and we thank her for coming all the way here for this lecture tonight. I'd just like to add one other thing. Leigh is, believe it or not, and this was not planned ahead of time, just happened. She is the third student of mine to give a lecture in this lecture series. And I would also like to mention that all three of them got an A in the class that they took. So please join me in welcoming
Thank you, Peter. Thank you. I have to say I thoroughly enjoyed that class too. It was one of the highlights of my public health degree here at the University of Montana. Can everybody hear me okay? Okay. Thank you for inviting me. And we're going to take a little trip to Northern Africa tonight. Like Peter said, I have been working with the organization called the Atlas Cultural Foundation since 2011. It's sort of a small world story, but when I was traveling to Uganda for my work in Uganda, my girlfriend Chloe Erickson, who was living in Livingston at the time, was traveling to Yemen and Morocco and other Northern Africa, Tunisia, and we would come back together in Livingston and having had these crazy world experiences, and we would say, nobody else understands what we're going through, and we would have major culture shock. And that's how we formed our bond. And Chloe is the one who started the Atlas Cultural Foundation. She and her husband, Christopher Erickson, he's a North Face climber, and they had gone to Morocco on their honeymoon, actually, to go rock climbing, and fell in love with the country. And that was in 2006, I think, or 2005. And after that time, Chloe and Chris both decided that this was a place that their hearts were just in love with, and they needed to stay. And then in 2012, I became involved because I had been running the health programs in Uganda, and Chloe realized that it was more than just, I'll explain, but she's an architect by trade, and so they were restoring ancient granaries in the area, and she realized that she loved the area and that there was more to than just restoring the granaries. She wanted to become involved in the community, and she actually lives there now half the time. So we have some objectives. There won't be a quiz. Somebody was worried about a quiz. There's no quizzes here. But the objectives, I want to just cover the work that we do, the Atlas Cultural Foundation. When I was doing my master's, when I was working in Uganda, we developed a model it's a model that I created based on some of the work that I had been doing, and it's called the PRESM model, and I'll go over that. The other thing I wanted to spend a little bit of time tonight talking about is this idea of sustainability, because I came up with the title, the sustainable communities, and then I was like, oh, sustainability, that's a pretty big word. What does it mean? And what are we doing to help be sustainable and while providing a sustainable community? So we're going to talk a little bit about that. And then the other thing I want to share is the work that we're doing, working with students and universities, and now we're working with Moroccan schools and Moroccan universities to build a bigger world and share Morocco and Montana and Canada as well, because there's so many similarities. They're so different, but there's so many similarities, especially when it comes to healthcare delivery, to climate change and some of the issues we're dealing with climate change. And so I feel like that's a really neat connection that needs to be not forgotten. And if anybody has questions, just jump out. Please don't hesitate to ask if you have a question. So as Peter said, the mission of the Atlas Cultural Foundation is to collaborate with rural Moroccans to improve their quality of life in the field of cultural preservation, community education, and public health. Working in Morocco it's challenging. In order to be a legal nonprofit working in Morocco, you have to partner with a legal local organization. And there are many people out there, many Moroccans that will say, yes, come and work in my village, or come and work with me. But if they're not a legal organization or an association, you can get in big trouble. And you can get in such big trouble that you're asked to never come back to Morocco again. And so that is something that we're very proud of, that we have aligned ourselves with an organization called SMIDI, S-M-N-I-D, and SMIDI means moving forward in Berber. And so ACF and SMIDI have had a partnership since 2009, and everything goes through the local association. So that and every question we ask in our health awareness days, every project that we do has to go through the association, and it has to go through the government, basically. So where is it? You can see on the map, I don't have a pointer. We're in a region called Zawiya Ahansal. And I talked to one gentleman that kind of knew where Zawiya, he knew where Azilal is. Have any of you guys been to Morocco? Okay, excellent. Yeah, Haley. Haley was on our trip last year. So this Marrakesh, and then we're pretty much due east of Marrakesh, up into the the High Atlas Mountains. It's a region that strategically placed in North Africa. There's 34 million people in the country of Morocco. The primary language is Arabic, Berber, and French. And Morocco is interesting. It considers itself a parliamentary constitutional monarchy, which I'm not a government person, but Morocco is quite amazing in its response in the last 10 years to serving the needs of the people. And while nobody's perfect and there's a lot of issues with a lot of governments, I have to say I've been very impressed with the way the king has strategically, done some actions that have kept the people fairly peaceful, fairly content. And even in the short amount of time that I've been going to Zawiya Ahansal, it is amazing how much infrastructure and how much has been given to this part of how much energy they're putting into the rural parts of Morocco. And that helps keep the people happy. And when you keep the people happy and they feel part of a whole system, that helps prevent other things from happening, which we've seen in other parts of northern Africa. I think of the Arab Spring and Morocco was very assertive in their, in their actions shortly after the Arab Spring to help not have an Arab Spring in Morocco. So this is the village, one of the main villages. There's 4 main villages in Zawiya Ahansal. It's about 15,000 people. It's a region that's cut by the Ahansal River, which is just a beautiful river. It provides sustenance, water for the agriculture. If it ever were to be contaminated or dry up, it would be a devastating thing for this region. And I'll get into a little story about that. But you can see the villages are very compact and tight. And then there's also the nomads that come up from the desert. And you'll see them come through in the spring. They have their camels. And they account for a fair number of people that are in the region, especially in the summer months. And then they go back down to the desert in the winter. When we say it's the second poorest region of Morocco, it's probably changed in the last 5 years. We don't have new statistics, but the students from this region are doing amazingly well these days on their test scores and getting into universities and going on to advanced education, which is, I don't think all just us, but I think it has to do with some of the infrastructure and some of the opportunities that have been provided for these students in the last 10 years.
So do they not do anything with adult literacy? Does the government not have
Adult?
programs for adult literacy?
In our region, the government doesn't do anything for adult literacy, but our organization does. We have a women's empowerment group, and we have an English language program, and the women are, and other men and kids, and I'll get into that a little bit. I don't know. Do you know, Shelley, do they have any adult literacy programs that are government sponsored? Yeah. Good question, though. So this is the model that my friend and I work for another organization called Hope to One Life. They're based out of Billings. And this is the model that we created. And the whole idea is that we work with a holistic approach. And I was working with refugees. I still work with them. And it's a little bit different scenario, but at the same time, I feel like in order to bring a person to a full potential and a community to full potential, while it seems idealistic to address all these things simultaneously, we can't forget each of these elements. Because if you have health care and you have water and you have a place to live, but your people feel hopeless and helpless, that's not sustainability. That's not community wholeness. So our goal is to address each of these components simultaneously, and it goes in waves. Post-war, so or I would say post-disaster, or you could say post-anything, or I mean, yeah, we've morphed it a little bit for Morocco because it's an empowerment model. The work I do in Uganda, it's clearly post-war and it was the post-war is how I started it.
Post-colonial.
Post-colonial, thank you. Yeah, yeah, exactly. Colonialism. Just want to make sure. So, well, the first component is the shelter and settlement, and the houses where the Moroccans live are these up in the mountains are these beautiful stone buildings, most of them. They're incredibly old. They're all handmade. The workmanship that goes into them is unbelievable. And again, when I, as with a public health eye, our goal with the settlement and the housing piece is it safe? Is it free of diseases? You know, is it potential? You know, is there a potential for diseases? And I'll get into our list. Sort of what we do is we work individually with families as well as with the community, and we've developed a list of what I call the individual household assessment. And as I'm walking through a village or walking through a compound, these are some of the things that I'm looking at, because these are some of the things that can really make the difference between being healthy and being sick. If your animals are living where your children play and the animal poops and the kid is playing in the poop, and then the kid gets picked up by mom, and then nobody's washing their hands, and then all of a sudden everybody has diarrhea, right? And that seems very simple, but this is it happens. And so our goal is to do education and to do workshops and to with very much respect and with honor to discuss these findings, or things that we say, well, if we keep the animals out then and keep them separate, then the children have a safe place to play, then nobody is walking in the poop and nobody's getting diarrhea. So these are some of the things that we focus on when I talk about settlement and household is that individual things because really change happens with individuals too. We want to see it from a community level, but it's the individual level too. So.
Do they accept it? Like, are they willing to make the changes, or is it difficult for them?
Oh, change is difficult.
Right.
So what do they say, 17 years to go from research to practice? So I feel that is, and I can't stress enough, our role is not to be punitive in any work that we do. It's not to criticize. It is, this is the reality. And this is why every year we repeat the same topics. We add new topics, but every year and every session we repeat the basic learnings. Whether it's washing your hands, having a safe place to dry your utensils, using Clorox a little bit. I mean, every year we have to go over the Clorox thing because somebody's adding like 2 cups of Clorox to their, cleaning. And so every time, every visit, we readdress them. And Haley can attest, she's been there. Would you say they're fairly accepting of the work we do?
Yeah, I mean, we had to change, we had to advance some of the learning because especially the kids were like, oh no, we got it.
Oh yeah, they and we really the kids are the sustenance. I mean, the kids are they're sponges and they want to learn, and that's really where the change can happen for the generations to come. But even the women just, and again, every project that we do, every teaching that we do is with the association SMITI. So they, we have full communication with them, and so if there's negative feedback, we hear about it from them for sure. Yeah.
Leigh, when I look at this slide, I remember the slide that you developed when you just went the course.
Wow.
And you presented the slide of the compound in Uganda.
Yeah.
Remember that?
Yeah.
And the basic point was to ask people what's going on here in terms of each one of these different components by looking at that one slide. I still use that in some of my classes.
Cool. Yeah. I know, if I'd been talking about Uganda, I would have brought that slide up. I should have a better picture of it. Actually, and when I look at this, it looks very tidy to me. I don't have an inside picture. I do, I just probably need a better picture of an inside. But nutrition and food security, of course, critical. This is a very fertile region. Because of the river running right through there, and they have amazing old strategies for irrigation. They have little canals that have been dug, and they use flood irrigation for a lot of their for their gardens. And it's been in place for hundreds of years. But they are at high risk for climate change. They're at high risk for infestation of bugs. They have a lot of potential problems that could come out in the future. But they're actually a pretty amazing community because they look out for each other. And even the people that don't produce as much or can't produce, they share. They have a communal garden that for people that don't have a garden, they share their abundance. So compared to when I was working initially in Uganda, it was like, wow, these people are so lucky. They have such great resources for food, and they have water, and they have fertile soil. But it's getting strained, and the climate is changing there. And so one of our projects is there is a professor from Montana State University in Bozeman, and he brings agriculture students. Tim Skeepel, and he brings agriculture students, and they do soil studies, and they look at the crops, and so that's one of the ways that we've been working with the local Moroccans to try to help with diversifying and planning ahead, so that so that we are one step ahead. So, and their typical foods are carrots, potatoes, onions. Corn, wheat, lots of bread. If you're gluten-free, it's a challenge, but it's really good bread. And they also are very fortunate because they have what's called the souk. It's a market, a roving market, and it comes into the village once a week on Mondays, and it's like Christmas every week. I'm sure they get completely bored of the same foods, but you can pretty much get anything you want there. You can get a toothbrush, you can get a new pot, you can get all the food you need. There's meats that come in, but it costs money, and there are quite a lot of the people, especially out because people live all throughout the hillsides here, and they are not wealthy. They cannot afford. So it's again, it's a subsistence living for a lot of the people around there.
And one, and you can pump this question if you're going to talk about it later, but just kind of wondering how you go from assessment to identification of need to prioritizing that to enacting that, you know, like, and who does, like, how do you run the trainings and...
Yeah, yeah.
That part.
Okay, we're getting there.
Okay.
All right. So water, sanitation, and hygiene, again, if you don't have clean water, you don't have life. So some of the projects that we've undertaken are through the Health Awareness Days, is a garbage program. So initially started, there was no garbage program. People just burned everything either in their hammams, which are their stoves in the house, to throwing it down into the river, to burning it in a tub in their back. So we actually developed a whole garbage program. There's now, the government has taken over the program, which was our ultimate goal. And so there's garbage cans throughout 3 of the 4 villages. And there's a garbage truck that comes and picks the garbage up and takes it up to an incinerator that the architecture students designed and built in one of the programs a couple of years ago. So that's an example of one of our sanitation projects. But I want to make sure I get to your... Another piece is the education vocational training. There is a tutoring program that was started by Atlas Cultural Foundation that's now with the support of the government school. And there's 2 tutoring programs, one in Agadir and one in Amzarai, the 2 main villages. And there are about 200 children that attend the tutoring program. It's pre-K through 6. It's free. And pretty much all the kids in the region attend that tutoring program, except the ones that live farther out. A few years ago, they built a new school, it's a junior high school, that actually allows students to board. So for the kids that live way out in the mountains, the kids weren't going to school. And the parents actually, and this is where the Moroccan government is pretty amazing, because the parents said, Mom said, we don't feel comfortable, our kids can't get to school safely because they have to cross rivers, and in the wintertime it's impossible. So the Moroccan government built a big school, and so now there's a boarding school for girls and boys for the kids that live out of town. So, and we work in that high school as well, doing some of the programs. Public health and our health awareness days. This is the health portion. These are some of the topics that we've covered over the last, since 2012 when I got involved. And as I said, we start with one, but every year we revisit hand washing and hygiene. Every year we revisit with the women how to do a self-breast exam and what to do if you find something suspicious and you're concerned. And we do not work in the local clinic. Our goal is to support the local clinic, because my firm belief is that if you as a medical professional go into a place and start handing out medications or doing some sort of, chronic disease management, that we're undermining the local health system. And we have to work with what they have, support it, and be a resource for professionalism, but not undermine it. So everything we do is public health related, education related, and anything that we can't, if we have any questions, if we're any concerned at all, we refer them to the clinic. And we don't work in the clinic. We don't have an affiliate. Well, we have an affiliation with the clinic, but we don't work in the clinic.
Who does?
There are 2 nurses that are mandated to be there. I can't say, I wish I could say that the healthcare delivery in that rural clinic was as good as it is in some rural Montana clinics, but it's not. They've had a real problem with, there's supposed to be a doctor there, and the doctor never shows up, and there's a lot of disgruntlement with the locals about that. The nurses do not speak the local language. The local language is Berber, and so there's some communication gaps there. But I'll tell you about this. I just spent a month back in October in Morocco with a group on a Canadian Health Institute research grant, and that's the piece, that's where I met Hassan. And we're working on helping rural clinics connect to the bigger hospitals in the city, and also have a partnership with McMaster University in Canada. And so we have a professional connection going. And with telehealth and all these potentials, it's, you know, the potential is there. It just is going to take some time.
Is there cell phone coverage up there?
Yes. It's better than at my house in Canada. I mean, they have 4G and it's really good. Yeah. So, okay, so I just had to look into a little bit, all right, what is sustainability? What do we mean when we say sustainable? And I looked it up in the Merriam-Webster dictionary, and I was really interested to see that to give support or relief to, which to me it was like, oh, relief, that sounds like money or something. But I also, of or relating to a lifestyle involving the use of sustainable methods. So it still didn't really answer my question, what is sustainability? But what I feel that the Atlas Cultural Foundation is doing, some of the things that we're doing to provide a sustainable relationship, develop sustainable relationships to support a sustainable community, includes some of these items on the left. And the number one thing I will say in any work that I've done, you have to have trust. If you don't have trust with the local people, you don't have anything. And this is especially important in Morocco. Well, it's important everywhere, but if the government doesn't trust you, you are out of there, because they will not invite you back. And if the local people don't trust you, you are not welcome. You are not going to be asked to go to their homes. You're not going to be asked to participate in any kind of education. You're not going to be asked to go to the schools. So trust is the number one thing. And we've just done that by being there. Chloe and her husband Chris built a place in Agadir about 8 years ago, and they live part-time in Agadir and part-time in France. So they are ingrained in the community there. Chloe and Chris have raised their daughter, Noor, in Agadir. She went to the tutoring school for the first 6 years of her life. Chloe speaks fluent Arabic and French and Berber and English. So, go ahead.
How do you navigate trust relationships with the government if you don't think that that government is necessarily doing the right thing?
I guess, well, I mean, I would say my feeling is that they're working, we have to work within their structure. And even in our own country, we have to work with our own government. We might not believe with what they're doing all the time, but we have to work within those confines. And it's the same with Morocco. I think maybe I'm a Pollyanna and I look at the glass half full, but I think, wow, look at all these great things they're doing for these people here, and this is fantastic. So those are the pieces that I look at, and that's where we work. We work in the potentials of all the great things that can happen and the great people, and not focus on the things that can't happen and that won't happen. Does that answer your question? Okay. So one of the, again, working with a variety of stakeholders is, and I'll get to that here in just a sec, Striving for agility, and I'll get to that in a few minutes. Supporting our leaders in the community and the creation of we've just recently created Atlas Cultural Foundation Morocco, which is a separate nonprofit run and staffed by local Moroccans. So that is the crux to how do we keep this sustainable. If something happens to Chloe or me or some of the other people working, we actually have people on the ground that are taking these projects on. We're mentoring them right now. We're sending them to leadership conferences, and they're learning the ropes. They already know the ropes pretty well. But if something were to happen, these guys are ready to step in and take over.
Are they from the area
Yeah.
or just Morocco?
Yeah, I'm getting there. Okay, so the way Atlas Cultural Foundation funds itself, because funding is a huge piece for nonprofits, right? And how do you stay sustainable and true to yourself and true to your mission, but have money? So Chloe and Chris, in 2000, I believe it was 2010, started what's called Atlas Cultural Adventures. And like I said, Chris is he's a climbing guide, he's an ACMG guide. So he does guiding in Morocco and other parts of the world. Chloe now has Atlas Cultural Adventures, which is the arm which organizes and puts together all the trips for the students from all over the world that are now visiting Zawiya Ahansal. And they visit in all different kinds of capacities, not just with me, but we have arrangements with National Geographic, Rustic Pathways, Global Leadership Agency, or I think I have quite a few of them listed here. Yeah. So these are some of the organizations that we work with, bringing students to Zawiya Ahansal for service learning programs. Or we do volunteer vacations. So that's what these gentlemen are doing. They're on an art trip doing paintings of the High Atlas Mountains as part of a trip through Atlas Cultural Adventures. All the programs that Atlas Cultural Adventures does supports Atlas Cultural Foundation. So that's where we get some of our money. We also get it from private donors who love the region, and we've had several private donors just donate just to restore an igurum. So an igurum is an ancient granary, and that was on one of the front pictures. I have more pictures of an igurum. And that's, what I say is that we have some agility, we have some flexibility. If a donor is not in our, with our mission and in the work that we want to be doing, then that doesn't fit with us, and we are okay to say no. And we've said no a few times to some pretty big donors, but they had agendas for Atlas Cultural Foundation to get certain things done, and we were like, I'm not sure we can do that, and I don't think that would be true to our mission, so thank you, but we're going to have to say no. And so far it's working out okay.
How many other non-Moroccan NGOs are working in the region?
One.
One other?
Yeah. And I'm not even sure they're functioning right now. Yeah. Not many.
Who is that?
It's a woman out of Nelson, BC, actually. And I don't think she even has a name. So, yeah, no, it's a very interesting, I'm not sure it's even legal. So in Zawiya Ahansal, there may be some smaller ones in some of the other, closer to Azilal, but in our region, in the 4 villages, there are no other non-Moroccan NGOs.
I'm just curious if I missed or if you skipped by accident the psychosocial and spiritual slide.
Oh, good point? Ah, sorry, thank you. And this is an IGRAM. So this is one of the IGRAMs that was restored. I can't remember what year this IGRAM was restored, but they're just amazing buildings. And the reason why I use this slide for the psychosocial spiritual is because the community pride is, for the local people, this is community pride. They are so proud of their heritage. They're so proud of the region, the beauty of the region, and that's what brings themselves spiritual strength. They're also very highly religious people, and so our goal, again, getting back to the question of, how do you work within the we're non-denominational. We don't have any religious affiliation. We accept people for who they are, where they come from, in whatever spiritual capacity. And this is a piece that I feel is crucial, again, to that sense of community and that lack of, in preventing isolation. That when you get that feeling like, wow, my village is really cool and this is a great place to be, it brings a sense of community, of pride, and that's the piece that we really focus on with especially the kids, and getting the kids. There are kids now that want to come back and live in Zawiya Hansal. They used to leave and they would be gone as fast as they possibly could because there were no jobs. It was not a very happy place to live. And in the last 15 years or so, kids are going off, they're going to university, and they're coming back and they're working. And I'll get to that. One of our employees, actually, is from Zawiya Hansal. The other employee is married to a guy from Zawiya Hansal. So, when I worked in Uganda, this was a very important component because of the war, and a lot of those kids had been through horrific things, and the families had been through horrific things, and that's why I felt it was really important to add that component. But having, do you ever anybody read David Brooks? He's a New York Times columnist. Anyway, he's got a really new book out that's so interesting, and he talks about that spirituality and community and how we need that in life to be fulfilled. So thank you for reminding me.
Religion?
I'm sorry?
What's the dominant religion?
Sunni Muslim. Yeah, about 99% Sunni Muslim. There's a handful of Jews and some expat Americans and Canadians and Europeans. There's quite a few. Obviously a strong French influence, and a lot of Spaniards come. It's quite close, so, but mostly Muslim.
The Berber is
Yeah,
big, and it's unique kind of Islam sort of.
Right, yes, right. So they're mostly, they're Berber, but they are Muslim. But if you ask them, they're Berber.
What exactly is that? Can you explain that? Berber, is that?
So a Berber is a tribe. They have been around forever and ever and ever, and they are the original people in that region. So they're tribal. And the nomads that go down to the desert and come back to the mountains, they're Berber. But then, and I can't remember all the dates because I'm not a very good historian. Maybe you know, Shelley. But when Morocco was taken over and Muslim became the main religion, then they were sort of adopted into, so they practice. Berber doesn't have its own religion really, but they're Muslims and they're Berbers. Does that make sense?
They were so named because they were supposed to be the barbarians.
Right.
And that's what the name is, so they don't like that name.
Yeah. Okay, so these are the full-time staff members we have for Atlas Cultural Foundation and Atlas Cultural Adventures. So that's one of the other benefits of this hybrid model is that we share staff. So they work about 60% of the time for Atlas Cultural Adventures and about 40% of the time for Atlas Cultural Foundation. But it all kind of melds because they're all together. But they're full-time employees paid with benefits. So the gentleman pouring tea is Ismail, and he has a degree in English from the university in Beni Mellal. And he runs a lot of the student programs, in-country student programs. The gentleman on the upper left is Ayub. He's been with us the longest. He has a degree in English as well. And the man to the right is the sheikh. He's the sheikh of the region, and he's a good friend of he's just a lovely man. And then the woman down here on the left is, or your right, is Shafia. And Shafia has been with ACF since the beginning, since about 2010. And she has married, Shafia and Ayub are from Ouarzazate. But Shafia married a local school teacher. He grew up in Zawiya, went off to get his degree, university degree, came back and is teaching in the village, and they got married. So we're very proud of them. They're unbelievably motivated. Some of the programs that ACF has supported them in is they did a U.S. Embassy leadership training program. They just got back from Germany, although Shafia didn't get to go because she's just about to have a baby. So, but they went to Germany on a program for computer literacy. They have done the English as a second language teaching, so they can teach English. They're just incredibly motivated and hardworking, and we couldn't do all of this without any of them. And so, and Shafia also is just started the Women's Empowerment Group, and that's where the Women's Literacy Program gets involved. So last fall, I was fortunate enough to participate in a Canadian Institute of Health Research grant. That was a group of folks from McMaster University, University of Texas, and a couple of universities in Morocco. And the goal is to develop an online platform for providers that can access this online platform for information and share information in regards to maternal and infant health in Morocco. And so that is ongoing. But again, it's the idea of, you work at the local level, you work at the national level, and you work at the international level, and trying to have stakeholders and people you're working with at all those different levels. And this is a work in progress. So some of the other opportunities that we have for Moroccan students, now that we have the Atlas Cultural Foundation Morocco allows us to apply for grants that are Moroccan-based. And students from Morocco that live in the city are coming to Zawiya Ahansal and learning about the programs, learning about community, learning about their heritage, learning about gardening, getting their hands dirty because they live in the city, they don't do that, learning where their food comes from. And the programs range anywhere from 2 days to a week. So that's one component of the programs that we do for students. It's not just an international, we're actually building the national program for students even more so right now. This was an English language program that was through the U.S. Embassy in Rabat. And so they spent time in Rabat, and then they came to Zawiya Ahansal and spent some days in Zawiya Ahansal. Now, the other thing is the opportunities for the international students, and this is where my work comes in as well. is that I do a service learning program through the University of Montana in Billings. And I have a variety of students from nursing, pre-med, health administration, public health, all different, lots of different kinds of students that go every year. We go in May. And I've been doing this since 2012. So you get to dig in the garden. This is our community garden. You get to dig in the garden with the sheik. And usually the programs last anywhere between 4 and 6 weeks. There's architecture, French students, health students. I guess that's probably the main. You get to experience Moroccan hospitality. The food in Morocco is really good. It's all lots of vegetables and the tagines and the spices, and it's just delicious. So this is the sheik's wife, Leigh Aisha, and the students often stay with the sheik. So they get to know the sheik's family and learn how to cook, and it's a full experience. We do the community engagement activities. So these are the health awareness days. It's working in the tutoring program. So we'll go to the tutoring program and teach about sugar and brushing your teeth. And interestingly, Morocco is experiencing a little bit of what we call the epidemiological U-turn. I don't know if you've heard this term, but I love it. Basically, we're going from communicable diseases to non-communicable chronic diseases. So it used to be, we worried about waterborne illnesses, and now we're worried about diabetes. So we need to be agile in that, and we need to be recognizing that, wow, we've got to start with these kids and like start working and teaching about sugar and processed foods, because they're getting all this processed foods now that they've got a road and a souk and everything is coming in with it. And again, who are we to say, we drink Coke and we like our cookies, and it's easy for us to say, oh no, you shouldn't eat any of that. But in reality, like, hey, learn from our mistakes, and please think when you open up that can of pop. The other thing we do with the students is that we always go on a mountain trek. You get to go up into the mountains for a couple of days, see how life is like up in the mountains, because it's different. Where we are is rural. It's 5 to 6 hours from Marrakesh by car. But that's the big city. The villages where we live and stay are the big city. And then when we walk into the mountains, it's anywhere between a day walk, 5 hours to a day. And life is very different up there. And you really get to see how hard life can be. So I think it's important to see that, because then you get a sense of like, oh, wow, if I got hurt up here, what would happen? If I'm having a baby and I can't get to and the clinic is a 5-hour walk, what am I really looking at? So we spend time, even though it's fun and it's beautiful, it's also an educational piece there too. So that was one of our students from the French program a couple of years ago, and they just love it. She was having a great time. And we've been doing it now for 11 years, bringing students to Morocco and working in Zawiya Hansal. And the other piece I'll share is that Northern Africa doesn't have the greatest reputation in America. And, I think we get these stereotypes and these stigmas that, oh, this is the way that everybody is, or isn't that dangerous? Aren't you afraid to go there? And when we bring the students, and they come home and they are absolutely thrilled, and they've had the most incredible experience. They've met these wonderful people. They've just learned a whole new culture. they tell their family, and then their family, they share it with their family. And that's how we bring this Montana connection, this Morocco-Montana connection together, because it's, you can think that it's so different on the other side of the world, but really it's not. And the people are lovely and they're wonderful, and it's so important to make sure that we share, that information is shared. So that's the other thing that I feel is great about bringing the students. And I did want to touch on the whole idea of, one of the pieces that I'm doing in some of my work is looking at healthcare delivery in rural settings. And when you look, as I was saying, is like if you're a 5-hour walk and you are having a baby, how do we manage that? And it's not that different in Montana. I know it's not, we have helicopters here. They actually have helicopters in Morocco. We flew a lady out a couple years ago that was having a dangerous birth. So it can happen, but there are so many similarities that we can look at. And I think that's, again, getting back to the glass half full. It's like, let's look at these similarities. Let's see where we can learn from each other and make the world a little smaller. So I think that's all I have. I don't know how I'm doing on time.
Okay, thank you very much.
I have a question about the health stuff. Are there government incentives, like are they sending people away to medical school and then bringing them back, I mean, if they're taking the kids, people, are they trying to bring in their health care from international areas?
They are. They actually have a mandatory, they're trying to institute a mandatory rural requirement, not that different from the Montana Rural Medicine Program, where if you go and work in a rural area for 2 years, you get your tuition paid for. They've actually implemented something kind of like that in Morocco. And I do know that there are some clinics in other rural parts of Morocco where it's worked. But again, the big thing is the cultural and the language barrier. And a lot of those students are coming, or medical students or new physicians or new nurses, they're coming from Rabat or from the big city, and there is a bit of distrust between the local people and the doctor coming from the big city. But, I mean, it's not that much different in certain places where I've worked in rural areas. There can be some distrust. And that's, again, where we just work to build that trust. So.
I was curious because you said that the King has really invested in these social programs, sort of in hopes to quell distrust or unrest. And I was wondering, since you are actively involved with their government, if there's a future plan projecting that decrease in infant mortality rate and having a bigger population growth, and how to mitigate that, like where those people are going to end up in 6 years. Do you know if there's an active structural idea?
So say that again?
So if you're investing in healthcare in these rural areas, then you're going to see most likely a decrease in infant mortality rate, a decrease in maternal death rate.
Okay.
Great. That means an increase in population.
Okay, yeah.
And so is there like some...
What's the plan?
Yeah, does he have a plan?
I don't know. Does any country have a plan? Do we have a plan here in the United States? I think, I mean, I think one of the things is that there is this huge potential in the rural area. And yes, the cities are going to get bigger. There's no doubt about it. But I think if one piece that has potential is to have instead of the brain drain and everybody leaving to go to the bigger city or to go to another country, is to try to bring people back to the local area, to improve the education level, which by improving the education level, you're hopefully decreasing the number of babies that everybody's having. I mean, I think that's their ultimate goal. but it's a, you know, that's a challenge. Yeah. Yeah.
In the work that you've been doing, the public health work, have you been exposed to people with disabilities? I'm curious to know what it's like.
Yeah. In Morocco, yes, a little bit. And they have a very open mind about the whole thing. They're part of the family. There's no shame in it. The resources are family strength. I wouldn't say there's a plethora of resources for people with disabilities, unfortunately. But at the same time, they're not shunned. In Uganda, it was horrible because, you know, we had one family member who had hydrocephalus and literally lived in a hut that was, he never went outside. Yeah, you probably experienced this. And it's horrible. And that is another piece about what I found when I went to Morocco. I was like, wow, this is great. Oman, do you remember Oman? Anyway, there's several kids in the village with disabilities, and they are absolutely included in all of the festivities. They're always around. They're in school with whatever school they can, you know, with the school that they can do. They're embracing. They're not, I know. Yeah, it's very refreshing. Yeah.
Could you say something about experiences with infectious diseases in the communities that you've worked in Morocco there?
Yeah. So I would say the biggest dilemma they had especially when I first got there, was infectious diarrhea. Their water source was horrible. It was E. coli, most likely, in the water. Every year in the dry season, the whole village would get sick, including us. And in the time that I've been there, they've developed a water association, and they were just getting water from the river or from a spring where the animals were drinking out of. I have a great picture. I didn't put it in, but there's all these donkeys, and there's the lady filling up her water jug, you know. And since then, they've developed a water association. They have gotten funding from the Moroccan government, and they put in a water chateau, they call it. So it pumps water out of the Hansal River up to a chateau, then it gets treated. They send water samples to the main office in Azilal, I think once or twice a month, and then it's chlorinated. So it's basically fully treated water. The number of illnesses from water illnesses, skin rashes, it is dramatically decreased. I don't know statistics because we have a very difficult time gathering statistics, but just all you'd have to do is look at the people and talk to the people. It's very qualitative data collection, but it's remarkable how much healthier everybody looks. And yeah. Yeah.
Things like tuberculosis or HIV, do you run into?
I would say again, I don't know statistics. I know there are instances of it. I would say the next biggest concern that we have is STDs. Because what happens is now that the road is in, the men go out to the big city, and then they come back and they bring STDs with them. And this is becoming a really big problem, and especially because some of the STDs are becoming resistant to a lot of the antibiotics. So we have been asked to do some education on it in the past. It was not a formal written document, please teach and do some STD education. So we're waiting for that. It has to be a little more organic. I'm not going to go in there and start teaching STD prevention. They do it at the clinic, yeah. And again, if anybody comes to us, like if we learn of anything, and right now we're in the midst of developing a community health worker program, so we're actually training some of the women and men to recognize and if signs and symptoms of certain things. We have different topics, and they are instructed to refer them to the clinic if they have any concern about that. Yeah. Yep. Yeah. No, it's a big problem. Okay. Haley?
You have done so many programs with APF, and you and Chloe and all the various partners. What program would you say was the most surprising in that it either just took off and you had no idea it would be so successful, or you thought it was just going to absolutely take off and it turned out it wasn't a good fit for the community?
I'm going to tell you, the menstruation program. Yeah. So last year when Haley came, we got to do, we have been asked to do an education on menstruation and hygiene in the government school, in the boarding school. Because the girls and the boys that live at the boarding school are from way out in the mountains. They are very shy, and there's been a lot of research around menstruation and girls not going to school because of their period. And so we were asked by the local association, SMITty, to go into the school system and do some teaching on this, and Haley got to do this as part of her practicum for her master's in public health here. And so we worked with an organization called Days for Girls that's based out of Bellingham, Washington, that make maxi pads, because girls can't afford maxi pads over there. They're very expensive. And so we are now, it's only been a year because we did the first one last year, and already I'm bringing back another 250 maxi pads or something like that. So they're sewn. It's a special liner that is then can be interchanged with a pad, and it's a whole teaching about the hygiene and the importance of hygiene and then going to school. And so it's been a huge success, and I'm very excited about it. I mean, we've done a lot of the hardest program, in contrary, the garbage program was the hardest program we've ever done. Because, again, that whole concept of getting people to go from throwing their garbage down here to in a bin was very, very challenging, and still is challenging. I mean, it's going on. But no, the menstruation, yeah.
You know, I'm so glad that you recognized Haley, because Haley is here, and she would be happy to talk to anyone who would be interested in what her experience was like in Morocco working on menstrual health. And also, the other thing that's interesting here is that we had a lecture last year, I believe, by a representative from Days for Girls, which is now up on our website. Is that right?
Yeah, Sarah Webb was the first speaker in January last year, and she was fabulous, actually.
Yeah,
that's great.
So that's where we found out about Days for Girls. Yeah, Small World Connections.
And they actually actively recruit volunteers to sew these.
Oh yeah. I bet there's a Missoula. I would bet there's a Missoula chapter.
Watching it, so yeah. And I have my sewing machine out now.
Yeah, you need to start a chapter. Because there's like 3 in Spokane. They're all over the place. So.
That would be really cool.
And so now what we're doing is we're teaching the women how to sew the pads themselves. So that's our goal this year. We're bringing some fabric, and we've just hired a sewing teacher as part of the Women's Empowerment Group, and now they're going to be sewing the pads themselves. Yeah, so that's pretty fun.
So I want to answer one quick question. I know Alexandra has a question too. So at the end of your talk, you said that one of the things that's so important is learning from each other. So what would you say, give us some specifics. What did you learn from your time in Morocco that you've been able to bring back in your work here?
Yeah.
Besides the lectures.
I would say the biggest thing that I've learned is a humbleness, and being humble in a culture that I knew nothing about, and learning about their culture, learning, becoming friends with these people, and learning about myself, and you know, again, you have these preconceived ideas of what, you know, I don't know anything about people from Northern Africa. I really didn't know a lot about Morocco the first time I went, and the first time after coming back, I just remember feeling very humbled and very honored that they allowed me to be in their life, that they accepted me in their community and in their lives. And I'm very grateful for that, and so is that?
Yeah, that's great. So one last question, Alexander.
What's the impact of online access if they've got 4G?
Yeah.
Somebody must have thought it was worth investing in cell towers. So
Yeah.
there must be enough of a audience for it.
Yeah. Well,
Leap over because they have it.
I'm sorry?
What will they be able to leap over because they have something?
Yeah. Well, they're definitely going to leap over phone lines. And in a lot of ways, I hope they leap over some of our ancient medical technology and can actually move to a better medical technology. What's that? Not yet, but that actually is one of our goals for that CIHR grant, is to begin trying to do some telehealth. That's one of the components that they really want to do. But the one downside of that is that there is a lot of bad stuff out there on the internet. And so that's been one of our great concerns, is just the kids are getting their hands on smartphones, and they're seeing things on the internet that they've never seen anywhere else. And unfortunately, this is how they're learning about sexuality. And it's a big problem. And it's not just a big problem in rural Morocco, it's a big problem all over the place. And again, and so the German group that's from Germany that have been working, that's their niche. And they're trying to do some education, and that's why one of the reasons why those guys were just in Germany was to learn a little bit about proper and, you know, how do we use the internet so it's a good thing and not a bad thing? But that's a really good question, because it's a double-edged sword, yeah. And they have a road, yep, the road, in 2000, so the road was very rough, and half the time it was closed in 2012, and then they finished paving it in 2015. Oh, yeah. And refrigerators and satellite dishes. You know, their favorite thing for the women to do now is watch Turkish soap operas. Yeah, and
on that note, before I thank Leigh for her talk tonight, I just want to make an announcement about next week. So next week we have Jonah Atterbury coming from, I believe it's New Mexico, is that right?
He's in Nebraska.
Nebraska. He's coming from Nebraska, and he's going to talk about the head and the heart, what global health research has to teach us about healthcare in Montana. This will be a really good way to end up the lecture series, I think. And then immediately after Jonah's lecture next week, we're going to have a reception. We call it the celebration event, where we invite all of you, people from the community, students, especially students who are graduating with the minor in global public health, and all of the lecturers who can make it, and the faculty and so forth, to come together and kind of interact for about an hour. Probably try to make that start around 7:30 next week, and we'll go to the President's Room in Brantley Hall for that reception. So put that on your calendar, and please join us next week for that reception as well. So this has been great. It's wonderful to see how someone from our Master of Public Health program has gone on to do so many wonderful things around the world, and even inspired Haley to go along with her at one point in time. And thank you for coming back, Leigh, and sharing all this with us.
Thank
and
you.
if anybody wants to meet with her one-on-one, I'm sure she'll be willing to do that. So thank you very much.